Hi, my name is Mary Grace. I am performing a skills video for nasogastric insertion or nasogastric tube insertion. I am in the proper school attire. My name badge is visible. Today, we are going to be performing the nasogastric tube insertion. So with that being said, I would gather all my supplies. I will need the NG tube. I have a cup of water. I have the basin, the 60 milliliter syringe. I have the absorbent pad, the water soluble lubricant jelly, pen light, stethoscope, a pair of gloves, safety pin, and tape. I will also need a pH strip and an elastic band, as well as a specimen cup. I am improvising. I do not have an elastic band. I do not have a pH strip, nor do I have a specimen cup. So I am using these just to kind of help fill it. So that is what we're doing. So I gathered all my supplies. I am going to double check the doctor's orders to make sure that the doctor ordered an NG tube to be placed. Once I have gathered all my supplies to check the order, I am going to bring my supplies with me and go to the patient's room. I knock on the door. I verify the patient's name. Hi, my name is Mary Grace. I introduce myself. Hi, my name is Mary Grace. I'm going to be your nurse today. May I get your name, please? I perform hand hygiene while she's providing me her name. Great, nice to meet you. I'm double checking her wristband to make sure that the name matches and it is perfect. That way I can perform the two-stepped name identifiers. I will then start putting on my gloves. And I will be taking, and I will put my supplies on a clean table, bedside table. Okay. Hello, Mrs. Smith. I am going to be performing a nasogastric tube. This tube was ordered for you by the doctor for your dysphagia or difficulty of swallowing. This tube will be inserted through your nose down to your stomach, and this does help you with absorption of food or medication administration. Do you have any questions before we begin? No? Okay. I will place the patient on a high Fowler's position and put the bed on the, and raise the bed slightly. I will be putting this NG tube in the basin of warm water, which is here. Basin of warm water. I do want to apologize if for filming purposes, I do not have much space. Our house did get flooded, so I am working with limited amount of space compared to where I usually would be. Like standing up, I have a bigger desk. You are able to see my desk properly. For filming wise, I do apologize. But from there, regarding the order as well, if the doctor did order suction for the patient, I would get the suction apparatus as well as the tube that goes along with it. As of right now, the doctor has not ordered that. So yes, so I will be doing, so my tube is there. I am going to check her nares for any, I will double check her nares and have her hyperflex her head up or tilt it up. Mrs. Smith, do you mind if I just double check your nares with my pen light here? Please go ahead and tilt your head up. Great. I am going to just feel right here. Septum does feel like it's in midline. I am going to occlude one side of your nostril, and you need to take a deep breath for me as I do the other side as well, so vice versa. Please go ahead and take a deep breath. Great. Now please do the other side. Perfect. Okay. I do find that the right side of Mrs. Smith's nostrils, the right side does have a higher airflow, so I will be placing the NG tube in that side. So from there, I will start to measure. So I grab it. The way to measure the NG tube is you will get the tube, and you would have the tip of the tube go to the nose, then the tip of the ear, and then down to the xiphoid, the tip of the xiphoid. And this one is measuring about 55 centimeters. So great, that is what we are planning to insert. Now, I'm going to be inserting the tube, and while inserting the tube, I want to make sure I document that when I assessed her nares, there was no signs of irritation, no signs of obstruction, no signs of abrasions, no signs of no signs of deformities noted. And then the septum is in midline. So I got that before inserting the tube, and then I will have her hyperextend her neck again. I am going to get my cup of water here, that way I can get it ready, and then open this up for her as well. Great, okay. I did have to tape my mannequin because the head just kept falling forward when I was practicing. I will also need to, while we insert it, I will also need to, it gets stuck inside the mannequin, so I can't fully push it in. So I have to kind of play around with it. There's a certain hole underneath the mannequin. But going back to the video, so I will get the lubricant jelly, or just water soluble lubricant. I am going to lubricate the tip of the NG tube. This is currently clamped, and I am going to insert the NG tube. You want to make sure you insert the NG tube with its natural curvature. So this is what it looks like, and we will go from there. So I will have her hyperextend her neck. That way I can insert the tube. So Mrs. Smith, do you mind just tilting your head for me, and then I will start inserting the tube. Oops. While inserting the tube, I am following the nasal floorway and going into, following that towards her ear, and then down to her nasal, nasal thorax. Once I get to her oral thorax, this is the area that she starts to gag. Once I see that, then I would give her some water to sip. Okay, she is starting to gag, so I am going to give her a sip of water. Every time she drinks a sip of water, I will insert the tube 2 to 4 inches, 2 to 4 inches more. So Mrs. Smith, go ahead and tilt your head forward and then drink some water or take a sip of water. Okay, go ahead and sip. Go ahead and sip. Oops. well, the mannequin is not letting me go all the way in, but yes. So once, I will say that right now we are at the 55 inch. So this is where this is what we measured before. I will, let me see. So yeah, this is what we measured before. I will, during this time while with the insertion, if I felt any resistance, I would pull the, I will remove the tube and relubricate and place it into the other nose. Or if my patient was not able to, or if my patient kept on gagging or needed a break, I would let her drink more water to help calm the gag reflex. So at this time, let me see. At this time, I'm going to take my piece of tape and I'm going to tape the tube so I can measure the pH level and the gastric content and check for placement. Okay, so from here, I would take my 60 milliliter syringe, provide 30 milliliters of air. I would then, before I do anything, I would place my absorption pad underneath her and kink the tube. So I would kink the tube, open, and then attach, and then unkink, and then push the air in. Once that is done, I will draw back 5 to 10 milliliters of gastric content, kink the tube again, and then clamp. Here, I will take my specimen cup. Oops. I will take my specimen cup and put the contents inside it and put the pH strip there. Depending on facility, it could be between 1 to 5 for the pH levels. And this one is within that range. So that means that the pH, that the tube is in the correct placement. So with that, I will take the safety pin and pin it onto my patient's gown. Now I will lower the bed and place her in a semi-Fowler's position to make her comfortable. I will then call the x-ray and have them come into her room to do an x-ray for placement check. Now the placement check has been done. And the x-ray team confirmed that it is correctly placed. So from here, if the doctor were to order the suction, I would connect the tube into the suction apparatus, but he has not. So here I am pretty much done with the NG tube insertion. Let me see. Yes, so I'm pretty much done with the NG tube insertion. Now regarding the plan of care, I would want to make sure that the NG is patent, as well as the tubing and the suction lining. I would want to note the characteristics of what is being the characteristics, as well as any type of drainage that is coming from the tube. And then once that is done, I will clean up. So I will clean up, take off my gloves, wash my hands, and then leave the patient's room. I will also, once I'm done with my patient's room, I will note the procedure, I will note the findings, and I will note how my patient is doing. And that is it. Thank you.